become again active, contributing members of society. A lot of really good work has been done by Action Mental Health in working with their client base. Within this small community, we have the opportunity to develop partnerships that will allow us to provide the AMH clients with the best experience possible. It's good for the individual, it's good for the community, it's good for the economy. Please do all you can to encourage it. Thank you.
Ladies and gentlemen, as you've heard, particularly from Billy and Nicola, mental ill health can affect anyone. So mental health is everyone's business. We have particular problems here, as Peter has already said. It costs £380 million a year. And research shows that in any 12-month period, 1 in 4 people display symptoms of mental ill health here. These are frightening figures. And given the current economic climate, there's every chance they will get worse. The problem was recognised just last week in England. The Deputy Prime Minister, Nick Clegg, announced a major £400 million drive to tackle the way mental illness is treated, with an ambitious target of helping up to 1 million sufferers and getting 70,000 people back into work in the next 4 years. Significantly, this puts mental health treatment in England on the same footing as physical illness or injury and attempts to end the stigma attached to mental illness. We would like to see the executive here do something at least as similar, or even more. By tackling this issue, we can help people recover, many of whom are the most marginalised in our society, and it will save considerable sums. Research shows that just through Action Mental Health, we can work our targets and getting individuals into work, it saves the Northern Ireland economy approximately £2 million per annum. So, our first request to MLAs is to help us sustain our services. We secure funding from a variety of sources to assist our clients to recover from mental illness. The bulk of it comes from the European Social Fund and through DEL, and this is matched by the health trusts. We heard last December that there are substantial reductions from April onwards, but we still lack clarity, and so we're still unclear about what resources we have to deliver services next year. So we're asking for some time to deal with these reductions, and we get some certainty as quickly as possible. The impact of the recession on Action Mental Health services is already being felt with an increase in referrals. Many of the effects of recession, repossessions, money problems and unemployment are well-known triggers for mental health problems. Despite an increase in demand, cuts to our services will mean we will have to turn more people away. Those people will be living with mental health conditions without the help and support they need. And we need clarity, not just this coming year, but some sense of what services and therefore resources will be required for future years to deliver a sustainable service. We want to work with partners in government and the health trust to plan services for the long term, whether that is through mainstreaming funding or by other means. But we do live in the real world, and we appreciate these are tough economic times. We are planning for funding reductions and also exploring other sources of funding and collaborating closely with other service delivery partners. Indeed, with the Cedar Foundation, we recognise the need for deeper cooperation, and we've been exploring the viability of a merger with the Cedar Foundation since 2009. This would create a major player in the voluntary sector to promote inclusion and enhance the life chances for adults and children with disability or mental health needs. However, recent European social funding reductions and certainly overfunding cuts have now thrown this into question. Our second request is that government should lead by example. There are things that government departments and organisations can be actively doing, and it's not just about money, more on mindset and a will to work. A joined-up approach by departments could actively combat stigma and promote a mentally wealthy workplace through policies and procedures. Government departments and agencies could also make a tangible impact by offering placements, just as Peter has been talking about, to people with mental health needs. This need not be very much, as little as an hour a week as work experience, just to start off with. What better way for government and the public sector to publicly demonstrate their commitment to those who need help most? It would be cost effective and would transform the lives of those involved. Now, in terms of our third request and letting us do what we do best, I'd like now you to hear from Colin Mockram, who runs our services in Craigavon and Town. Colin.
Good afternoon, and can I thank Dolores and Jim for the joint hosting of this afternoon's event, and also to all the gathered for support in the launch of our manifesto. It's not that long ago that you wouldn't have got this many people into a room on an event around mental health, and whereas to practitioners like ourselves, this is very encouraging. I think we have to accept that we're at the early stages of a journey, and that today's topics of mental health and learning disability must be more than a moment, and much more of a focus in the forward planning, so we can look forward to where we're going, to where we get to, and the destination of where that journey might take us. AMH can and want to help. At AMH we are capable and committed of achieving this. So why are we best placed to assist and lead in the delivery of certain elements of that modern mental health service that Northern Ireland deserves? Well, we have a dedicated and committed staff team that feed off almost 50 years' experience in providing flexible and responsive community services to the people that come in through our doors. In that time, we have forged effective and extensive networks and partnerships at both operational and strategic level. We work across all sectors. AMH staff currently are represented on different work groups at regional level, such as the Bamford and Protect Life Monitoring Implementation Group that was recently formed under PHN. We sit on the Suicide Strategy Implementation Body at regional level, at trust level, at voluntary and community level. We also were involved in the Department of Health's development of the new mental health promotion strategy. We work across education, employment, and sit in other groups that are non-mental health, such as Children's Services Planning, and the recently formed local safeguarding partnerships that are emerging in Northern Ireland. And all of this involvement gives us an opportunity to influence policy and the direction of future services, and an influence across regional and local action plans regarding the implementation of strategy and known good working practice. This insight also informs the work that we do to make sure and ensure that we remain focused on and aware of effective working practice. This knowledge and experience gained by our staff has resulted in models of service across Northern Ireland that deliver and meet the actual needs of people coming in through the doors, as Billy and Nicola have outlined. In knowing what our services do, I am confident at different levels that currently Action Mental Health is working to promote the 5 key themes that were identified and published in the Bamford, Implementing Bamford document that was published last year. We currently do promote positive health, well-being and early intervention. That is achieved across our mental health and learning disability services. We do support people that lead more independent lives. We help families and carers. We provide better services for people that meet their actual needs. And we provide structures and the basis for what will be delivered under the Bamford vision. But more than this, in doing what we do it best because we involve our client at the centre of everything we do. We work closely with our client, and Billy outlined the process of that. That informs our role and function and our involvement in the people that come in through our doors. And that then results in a framework that we call the client development process. That process itself is not new to Action Mental Health. It might have a different name today, but it has been about since we've been about. We have always put people at the forefront of what we do. That approach is consistent with current thinking, outlined in the Delivery Bamford vision, in the text of the Patient Client Council, and in the requirements of the Northern Ireland Social Care Council. The process itself is reasonably straightforward. From the outset, we identify if and how we're going to interact with that individual. If it is agreed that we can work with that person in a positive way, we'll then identify need as action under an action plan. It's accommodated then under our 3 main programme themes. There are employment, vocational training and life skills training. And all of the efforts under those three headings underpin preventative work, they initiate early intervention, and it enables support and recovery. Helping to keep people well is what Action Mental Health does best. Keeping people well results in people that are less reliant on primary mental health care services, secondary care services, medication, so on and so forth. And if we take medication, and the use of medication in particular, we know in 2009 antidepressants in Northern Ireland alone cost the public purse somewhere in the region of £18 million. But more than that, when people are well, they're more able to contribute to family life, to get involved in their local community, and as such start to address the stigma that still surrounds mental illness in today's society. But it is addressed in a much more normal way than we can ever hope to achieve, just by that interaction. And as such, social inclusion is then promoted. But when people are well also, people can and people do and want to move off benefits. And we know that this is resonant with government, because 40% of incapacity claims we know relate to mental health problems. At Action Mental Health, to achieve this, we have to and must nurture effective partnerships, and as Peter has explained,